And there are 8 now centers around the state that are called crisis pregnancy centers, but they are not healthcare centers. They are not medical facilities whatsoever. And yet they are fronting of, their front is to provide pregnancy counseling and services to Vermonters, and it's misleading. And they also counsel people away from abortion access. And we're live. Hello. Welcome to the House Progressive Caucus. It is February 7th, 2023, and we are just getting started. We did a few updates from House leadership. We were just talking about a couple bills that caucus members are passed around for co-sponsorship, and then we'll have a conversation on universal primary care for the record. And I'm Representative Emma Mulvaney-Stanek. I'm the caucus leader. So anyway, this bill is really designed specifically under consumer protection, so it doesn't legitimize these centers as medical facilities because they're not. And it hopefully also threads the needle around the legal times that we're living in to make sure that these clinics have to be transparent in who they are, that they cannot collect data from clients because they're not patients, because it's not a medical facility, and collect people's data and use it for all the various ways they get funded and the larger national organizations that are very interested in counseling people away from abortion access. So I will pass that along to any legislator who's here who's interested in signing if you haven't done so already. And the other one very quickly is on legislator compensation. I just got this back today. And so this bill has a few core components to make this job more accessible to average working Vermonters. The biggest piece in here is it moves us to a salary-based payment system rather than this, in my opinion, antiquated per diem system, which makes it nearly impossible to do this job unless you're economically wealthy or can somehow, with your mental health, do a second full-time job on top of being a legislator, which is undoable given how complex and important this job is for the state. So it has that, it has access to health insurance. It has a child care and dependent care stipend in here, reimbursement for folks. And there is also a provision in here around compensation for orientation periods, which is unpaid. If you get elected to the state legislature, you are expected to give a lot of unpaid labor before you're even being paid by the state. So if you're interested, take a look and you can consider co-sponsorship. Any other bills people want to share, including members who are visiting? Any bills?
Some that I don't have sign out sheets for yet, but can I say what they are? Just
yeah, certainly. If they're not going to be ready for. I mean, you can either wait till next week or you can speak to them.
Yeah, well, I'll just give you a heads up because there's going to be a quick turnaround because we're approaching the deadline. One of them, it puts a moratorium on construction of more prisons and lifts the moratorium on aiding the construction of schools. One of them gives tenants the right of first refusal to purchase their housing before it goes on the market when landlords go to sell it. And one of them adds 2 faculty members to the UVM board that's on behalf of the union. And one of them is a pilot project for alternatives to incarceration that would replace prisons with secure housing for people who need to have their freedom restricted and provides wraparound services for them. And then creates a continuum of housing to replace prisons, basically. But so there'll be more details, but I just want to give a heads up because it's going to be quick. I'll be sending you the bills and be asking for you to sign it quickly.
Great, thanks, Brian.
Thanks.
Yep, thanks for heads up. Any other bills before we go to introductions?
I suppose I should give a heads up.
Yeah, please.
Then, because you're right, it'll be a quick turnaround. Representative Jubilee McGill and I have put in a minimum wage bill request. It would set the minimum wage at the livable wage, the average livable wage for a household of 1 working adult. So that means equivalent to a single person working full-time and renting a 1-bedroom apartment. That wage in 2023 is $19.45 an hour. It would also include a bunch of provisions for eliminating exceptions to the minimum wage that are currently in Vermont statute, has some study language that's comparable to another bill that Representative Bloomley co-sponsored about looking at the livable wage calculation in statute, how that's calculated. So we might take that part out. And then it also includes a tax liability, a tax credit for low to moderate income small businesses, or low to moderate revenue small businesses that have a pretty high ratio of of full-time employees to revenue to enable them to be able to afford to pay a much higher livable wage for their staff. So that'll come out. We're hoping that bill language will be finalized this week. And so we'll be looking for signatures on that bill.
Great. Thanks, Kate. Any other bills? Okay, we'll have another round next week, but we are getting towards the deadline of bill introductions, so we are probably going to be wrapping up. And this is also why you might see some bills just going in with one sponsor, because we're starting to run out of time of finding people to put their names on. Brian?
I just wanted to clarify that it's the deadline for long form bills, but I didn't tell you any short form bills because there's no deadline, so.
Right, we can come to
those, yeah.
later. Yeah, great, thanks. Okay, so let's go around and do introductions for folks at the table. And we do have other guests at here at the House Progressive Caucus who are listening in. And if we have time at the end with discussion and questions, we'll certainly open it up to our guests as well to ask questions. So Representative Chena, do you want to start with just introductions, and we'll go all the way around the table?
I'm Brian Chena. I'm a representative from Chittenden 15 in Burlington. And it's most of the East District and part of the Old North End, and I live in the Old North End part.
Ella Chapin, representative from East Montpelier and Middlesex.
Representative Kate Logan from Chittenden 16 in Burlington.
Representative Kate McCann from here in Montpelier.
I'm Representative Troy Hedrick from Burlington, also Chittenden 15, so I share that district with Brian. I'm kind of on the other end of it.
Representative Taylor Small from Winooski, and I'm also the Assistant Caucus Leader.
Again, Representative Emma Mulvaney-Stanek, she, her pronouns. I represent Chittenden 17, which is one side of the Old North End and part of the New North End.
My name's Sarah Shortino. I'm the legislative assistant, and I live in the South End of Burlington.
My name is Liz Medina. I am the Executive Director of the Vermont State Labor Council, AFL-CIO, which is our state's federation of labor unions. I use she, her pronouns, and we're all over the state.
I'm Ethan Park. I live here in Montpelier. I'm just a private citizen, but I've been involved in healthcare reform activities for a long time. Thank you for the invitation.
Yeah.
Dan Barlow. I use he, him pronouns. I live in Barrie, and I am the director of the People's Health and Wellness Clinic.
And I'm Kate Cannelstein. I live in Burlington, and I'm the director of the Vermont Worker Center, which is also a statewide organization.
Great. Thank you all for being here, our panelists and our visiting legislators. You're welcome anytime to this caucus. We're always open. And I asked Representative Chena to help just facilitate this next portion, given that he is the lead sponsor on H-156, which is the Universal Primary Care Bill that was just introduced last week, I believe. The days are blurring together already. And I'll just pass it over to Brian to lead us through this discussion and panel.
Thanks. So thanks everyone for coming today to talk about this important issue. As everyone is aware, our healthcare system's in crisis. We're seeing Vermonters struggling with higher deductible insurance plans, crushing medical debt. People are self-rationing their care. The cost of pharmaceuticals is out of control. Primary care physicians are dealing with inadequate reimbursement, rising caseloads, ever increasing administrative burdens. The mental health care system in which I work is at a breaking point. The Accountable Care Organization seems to be burning up a massive amount of time and resources and energy, but we are seeing little to show for it. And Blue Cross Blue Shield has just exited, which is kind of putting things in peril. And the state had made a promise to the people many years ago in Act 48 to provide universal health care that we've never fulfilled. And so at this moment of crisis, we have an opportunity to revisit this concept, and this bill is one way to think about it. And I know there's many different ideas about how we should approach universal health care, but I think it's important at this moment in history that we put the differences aside and we try to look for what we have in common around this vision, and that we organize and fight and make it happen finally. And so I appreciate you all for coming today to share your different perspectives from your different groups. Did you want me to just say briefly, like in a few sentences, what the bill does for the people who may not know? And then, because I'm not going to go through all the details, it basically creates a structure of government to work with other structures of government to come up with a plan to fully implement the dream of Green Mountain Care, which is what Act 48 was about, over the course of 10 years. But starting with providing universal primary care, which includes mental health and outpatient services in the first 2 years, leading to vision, dental, and hearing aids. So within the first 2 years, we would guarantee the people those things as a public good, while we take 8 years to figure out how to fold in the more complicated pieces. And something people should know is that we have to reform the way we're paying hospitals. That's already on the agenda. So why not do this in the meantime, while we're figuring that out? That's kind of my basic pitch on this bill. And I will turn it over at this point to our guests, because really we want to make space here to hear from you. Do you want to do like a four-way rock, paper, scissors and see who's first? Or maybe I'll start with Kate because you're across from me. So we'll start with Kate, and maybe you could just say who you are and where you're from again, so I don't have to try to remember your exact titles and stuff. And maybe do we have time for each person to do 5 minutes and then do questions and discussion?
That would be ideal.
I'll set a timer and I'll kind of make winks and gestures. I'll vogue at you, or whatever.
Maybe more like 4 minutes, just so that we can make sure. And if you don't need the full 4 minutes, that way we just have a robust discussion.
Okay.
That's our goal.
Well,
thank you.
Thanks, Brian. Yeah, thanks so much. And thank you, everybody, for the invitation to come talk today. It's really great to be here. And thank you for all the work you do. I think most folks know me before, but I'm Kate. I'm from the Vermont Worker Center. I live in Burlington. We are a statewide grassroots organization celebrating our 25th year this year, a history that many of you have been a part of in various ways. And we're also part of a multi-state initiative on the national level, building what we call the Nonviolent Medicaid Army, sort of inspired by Dr. King's vision for a nonviolent army of the poor, that are state-based campaigns for universal health care around the country. And so one of the things that I just really want to lift up today, and I'm sure it's on your radar, but that this year, we're expecting that about 30,000 people are actually going to lose their access to Medicaid because of the end of the continuous coverage requirement by the federal government to keep people on Medicaid during the pandemic. And I bring this up because it's actually going to be, I think, a very huge issue for people in our state. And the way you hear the Scott administration talk about it is almost like more of a logistical problem. How are we going to get these people signed up for Vermont Health Connect? But actually, I think most of us know that that's not a solution, that if you've qualified for Medicaid sometime in the last few years, the idea of having to pay now premiums, co-pays, deductibles is not going to be a viable option. And we're talking to people every day who are terrified of this situation. And I think the other thing that this tells us is that it's just the opposite direction that our state needs to be moving in. Talking about the promise of Act 48 and this commitment of the state to move towards healthcare as a public good. Over the last 3 years, we've seen, we expanded Medicaid to cover more than 30,000 more people, and now we're taking that away versus moving more in that direction. So I think that's one thing that we need to be really conscious of, and really conscious that is good, and really need a loud voice on this crisis that's about to hit people starting April 1st this year and over the course of the next year. And I think it's an opportunity for us to talk about healthcare more, to seize that moment of frustration and hurt that people are going to be feeling. And the second point that I want to bring up in relation to this bill too is some of the lessons that we at the Worker Center are really taking away from the period of fighting for winning Act 48 and then the setbacks that we faced. We actually had in this state, and many of you were a part of this, huge historic victory that was supported by grassroots organizations, organized labor, progressive legislators, and resulted in the victory of Act 48. But there was a coordinated backlash by many different forces, but and probably some of you remember the mass mailers, the super PAC money, the efforts to unseat legislators that had supported the bill. And so I think as we look at moving towards fulfilling that promise and making healthcare a public good, we just need to know that opposition is going to come back to us, whether, that moment is going to come when we move towards taking healthcare out of the sphere of profit and into the public good. We're going to face that not just from the millionaire households that would be taxed under a progressive income tax, but from national business groups and the healthcare lobby that's already spends the most on lobbying in the state than any other sector has healthcare, and including UVM Medical Center, who's sitting on $1 billion reserve that we're going to need to tap into to transition to a truly universal healthcare system, money that should be used for that. So we're going to need a political counterweight to that. And I think that's where we are, that's where we see the need for a real organized mass grassroots movement that can enable our progressive lawmakers in the state to lead the charge on that. That's my time. Can I say one more thing?
Yeah.
Thank you for keeping time. So I just want to say all of that because I think what we're seeing is what we really need in order to be able to organize and mobilize the kind of public support that's going to be needed to actually face that opposition is actually to put out a vision for what people really need, which from our conversations out there, what we're hearing from people is not just primary care, it's all medically necessary care. It's people who are worried about losing their access to their cancer treatment in 3 months when they lose their Medicaid, it's now, it's not in 10 years. So I think what we would love to see is actually a vision of a bill that could pick up where we left off with Act 48 and move towards that. And I think, as Brian pointed out, our goal is to end in the same place. But I think from us, what we're seeing is putting out a vision of moving to all of it now would give us the ability to really energize and mobilize the base that we're going to ultimately need in order to go up against the forces that are opposed to this. I think this bill is an awesome temperature check. It's amazing to see how many co-sponsors there are, and that gives us a sense of how much support we have in the legislature, and we're grateful to see that. So I think I'll just leave it there for now. But thank you for having me here and happy to discuss more and look forward to hearing what everyone else has to say.
All right, next.
Sure. Thanks. Dan Barlow, Director of the People's Health and Wellness Clinic. We are a free healthcare clinic in downtown Barrie, one of 9 throughout the state. And I want to make it clear I'm here as an individual, not representing the organization, because we are a 501c3 nonprofit, although this bill is in line with our mission and values as an organization. I've spent 20 years, basically my adult life, working on healthcare reform as a journalist and then a lobbyist, and now as someone within the healthcare sector. I want to talk a little bit about what the People's Clinic does and how actually I think we are a model of what a healthcare system could look like under universal primary care. So we've been in existence for almost 30 years. We provide completely free care. We don't charge insurance companies. We don't charge individuals. We don't charge public programs at all. If you make less than 400% of the federal poverty level, you can get our services. People come to us to see a family doctor. They come to see a dental hygienist. They come to see a counselor or a mental health professional. Sometimes they come to see us for body work, acupuncture and massage and other things. The essential healthcare services that a person needs, month to month, sometimes day to day, we can provide. Most of our care is provided by a roster of about 40 volunteer doctors and nurses who come in once or twice a month to see patients. It's kind of a really incredible model. What we are seeing, though, is continually increased demand for primary care. In this past year, we saw more than 500 unique patients at the clinic, and that was an increase over our pre-pandemic numbers. We saw nearly 200 brand new patients at the clinic last year. These are people who have not seen a doctor or a dentist in their adult life. And through our experience at the clinic, we are seeing both miracles happen. People who come in, for example, and maybe think that they have a really serious health problem, or that their teeth are in really bad shape and may need some extractions. And they find out, in fact, they just need to be put on a preventative health plan. Maybe they need a cleaning or a couple cavities filled, and they're fine. On the other side, we see people come in and find out that they have dangerously high levels of blood pressure and that they're close to having a heart attack. They find out that they need all their teeth extracted because they haven't seen a dentist in 20 years. So we're seeing both sides play out here. The miracle of primary care, but also the damage that our for-profit healthcare system has done to people's health here. I know folks may know Dr. Alan Ramsey, been a big supporter of this bill over many years. He's also our medical director at the clinic. And if he was here today, he would tell you that investing in primary care saves the system money down the road. And we certainly see that at People's Health and Wellness Clinic. We are a lifeboat within the system for people who have been shut out of healthcare for so many years. And we know that each person who walks into the clinic and gets preventative care, gets primary care, they're not going to show up at the emergency room in a week because their condition's out of control. So this is a real investment. We save the healthcare system millions of dollars each year by simply existing. I do want to talk about dental a little bit because I'm really glad that this plan does transition to some dental coverage. Folks know that most people don't have dental insurance in Vermont. We still treat teeth and the brain and the eyes much differently than we treat other parts of the body. And we are seeing increased demand for dental. We added a dental hygienist as part-time staff for about 5 years ago. Today, half the patients coming to us are there for cleanings and x-rays and stuff like that. This is, part of the growing oral healthcare crisis in this state. And this would put us on the path to ensuring that everyone has the essential coverage that they need. Looking forward to this continuing this conversation, and I appreciate being here in the room. Appreciate the representative sponsoring this bill and seeing some of my friends who I spent many years in the trenches with as well. So thank you.
Thanks.
I'm Ethan Park, citizen here in Montpelier, but I've been involved in this issue since the mid-1980s, actually. I was a dairy farmer up in the Northeast Kingdom. My family didn't have any health insurance. I began making the trek down here to Montpelier. I think the first time I testified in the legislature was 1986, maybe. There was a bill at that time sponsored by then Senator Peter Welch and Representative Paul Poirier. And that bill, we filled room 11 with people telling their healthcare stories. And the bill was scuttled after testimony by the Blue Cross Blue Shield lobbyist. I want to use some of my time here to hopefully inoculate you as legislators against some of the counter arguments for H-156. So these are some of the things that I've heard. Number one, it's pie in the sky. Well, it's been a very doable goal that has been done all over the world, as we know. So it's not unattainable. We can't get the federal waivers. Well, we can get the federal waivers. We get federal waivers for Medicaid all the time. All we really need for this bill would be a Section 1332 waiver so that we get the ACA funds to be put into this program. It'd be nice to have a Medicare and a Medicaid waiver too, but we couldn't need it to get started. The administration, the Scott administration, is not on board. Well, true enough, but that's not stopping the legislature from going ahead with paid family leave, with childcare, with universal school meals. It shouldn't be an impediment to going ahead with H-156. How are you going to pay for it? Well, unlike some other programs, this is, in a sense, it's not really a new program because we're paying for healthcare one way or another already. All we're doing is changing the financing away from out-of-pockets, away from private insurance premiums, and funding it publicly with taxation. We're too busy. Well, that's the old, we can't chew gum and walk at the same time excuse. I don't buy it at all. Healthcare has a workforce crisis. Well, indeed it does. This bill would help the workforce crisis by funding in a deliberate fashion the needs of our population. So I think it would attract especially primary care providers and clinicians to come to Vermont and practice here. We've tried it once and it was too expensive. Well, Peter Shumlin pulled the plug in 2014 on the program back then. And you keep hearing that it was because the price tag was too high. My analysis is that it was a political problem. It was not a logistical problem, it was not a financial problem. It was a political problem. It was a lack of political will to get it done in the legislature. And the fact that Peter Shumlin was in a lot of trouble for other reasons at the time made it impossible to go ahead. And finally, I've heard it's just too new. We need more lead time to think about this. Well, I go back to the 1970s on this issue, really, because not that I was involved then, because I was young and felt that I was invincible and didn't need health insurance. But at that time, Senator Edward Kennedy had a plan in the back of his head to run for president with a signature issue of national single payer. And for a lot of reasons, that didn't happen. But shortly after that, Bernie Sanders was elected mayor of Burlington. He visited Canada.
So we have one more speaker, last but not least.
Thank you. Thank you so much for giving me this opportunity. Again, my name is Liz Medina. I'm the director of the Vermont State Labor Council, AFL-CIO, which is our state's federation of labor unions, representing over 12,500 workers across Vermont. And I have to say, just personally, this is a really big issue for me. And I can't believe that we went through a pandemic and still don't have universal health care. And I'm still personally, as a worker and a person who is engaged to an essential worker, dealing with that lack of care and the fallout from that. I remember during the pandemic, my partner, Andrew, works at Hunger Mountain Co-op. And every night he'd come home and would do put all his clothes in a garbage bag, take a shower, do all this stuff because we were so scared. If we got sick, we probably wouldn't necessarily even be able to go to the hospital on time or things like that. We constantly have to ration care. Our deductibles are really high. We are insured, but we're not really insured. $5,000, unless it's really, really serious, we're not going to go. We're not going to go. And to think that, these workers, my fiance and so many other are doing essential work, keeping this community together, and there isn't a just healthcare system yet is still really shocking to me. So I think, with all the arguments we are going to face in fighting for this bill, it's really important to remember the moral question as well, that this just is the right thing to do. And, to get into all the other, problems this solves as well, I have to say I've been in a lot of contract negotiations. And I personally, when I was a union member at Goddard College with their staff union, and I've seen quite a few as a director of the Labor Council, and wages cannot increase, or we cannot keep up with the cost of living during because we are constantly having to plow all of our negotiating power into just maintaining healthcare, just maintaining these bad plans. And these are the plans that most insured people have. So, I think 97% or so are insured in the state. Half of them are through employer-sponsored health plans. And then a third of those folks, those workers who are on those employer-sponsored health plans, they have reported that they had to ration care because it's not affordable. And what's even more shocking is that even the CEOs are admitting that this is just not at all sustainable. There is a really interesting report that came out in 2021 from the Kaiser Family Foundation, which found that 87% of CEOs admitted that in just 5 to 10 years, it would be unsustainable to provide health insurance at all. And so, this is really a crisis that has been brewing for a long time, and we're only going to see more harm and, collapse in our families and communities, really, if we don't do something about it right now. And I would really like to be able to, go to the negotiating table or see people going to the negotiating table, being able to actually negotiate for the wages that they deserve and everything else so they can afford to stay in Vermont, so they can afford housing and all the other things that are eating up our income, and not to have to worry about healthcare like most workers in developed countries around the world. So I'll just leave it there, keep it simple, but thank you so much for your time and happy to answer any questions.
Wow. Finished exactly in 4 minutes. And thank you others for wrapping it up when you heard the alarm. It makes me not have to like exert any kind of force or power. So, we have time, chairs, for some questions. So do you want me to kind of moderate that, or do you want to take it over?
Sharing, okay, fine. Yes, sorry, I was just teasing too. Yes, yeah, no, it'd be great to start with around the table first, and then if
Okay.
you don't have a lot of questions, we can open up to the larger group. It'd be great. And to our visiting legislators, you also can jump in right in the same queue as everyone else here too, yeah. Do you want to call on people, Brian?
I don't have to do that. I mean,
Mine's quick. Send a reference to that Kaiser study.
Yeah,
Thank you.
what did you ask for, though? I didn't hear you.
Just a link to the Kaiser study.
Yeah. I would even add to that, like I heard a lot of data, qualitative and quantitative mentioned, and that building a body of evidence is going to help us make the case. So if you have sources, maybe of data to support the case, it would be great to work together to assemble that and prepare, because my hope is that we will get some testimony time, and then you and others can be invited in, to present your perspectives to make the case for some action. So
Can I just follow up? I don't know why this hasn't, your point, Liz, on how this is such an overwhelming presence in union negotiations that we can't talk about anything else. I just want to be deliberate going forward about keeping those connections. And I mean, you're with the people to keep those connections going with, but with the other workers' unions, I think there's some tremendous power in keeping that in the conversation.
absolutely. And I forgot to mention, we're also part of a nationwide movement, Labor for Single Payers. So this is increasingly an issue with workers who have supposedly good insurance.
Yeah, well.
Other questions or even comments too from folks around the table first? Yeah, Ella?
Well, I'll just say it was campaigning for the first time this past summer. It was by far the most asked for topic by constituents. I mean, it was overwhelming. Childcare was close runner-up, but I'd say primary care and just fixing the healthcare industry was by far the top. And I'm not very familiar with the nuance of any of this, although I shared an office with Ethan Park for many years, and so had a good constant, just appreciation for how many people like Ethan have been working on this for decades and care so deeply about it because of what they see in their families and communities. And I guess my question would be, so thank you to everybody in the room who has been working on this issue for years or decades. I'm very much supportive, but I don't know a lot. So I guess my question would be, what entities that represent primary care providers are engaged or working on this? Like from the primary care provider perspective, I've certainly heard from individually that any primary care providers want to see this kind of a step, and people are leaving the industry rapidly. We're losing primary care providers right and left. So I guess I'm just wondering what other entities that you all work with or know of can really share that voice.
There's lots of individual primary care clinicians who are speaking up. Doctors tend to be not real well organized in organizations. We have the Vermont Medical Society, and the VMS lobbyist has been decidedly cool on this proposal. We'd love to change that. But some of the horror stories we're hearing from primary care providers who are just burned out, overloaded with paperwork, really unable to take care of the patients in the way that they would like to, and the way they were trained, and what brought them into the profession as a compassion for people and wanting to help people. They can't do it because people have very high deductibles, even if they're insured. And so, even a diabetic patient who's not getting their regular primary care and getting their blood sugar checked and so forth, come in too late and need an amputation or something. So it's heartbreaking. But we need the voices of clinicians, and we hope to do more with them and their voice heard in the legislature.
Go ahead, you go, and then I want to make a point.
Sure. I wanted to actually build off something Liz was talking about a few minutes ago. You talked so eloquently about, your experiences as a family being underinsured. And I think that's something we have to continue to talk about. At our clinic, back in 2007, I was looking at some historic data. So 15 years ago, 90% of our patients coming to the clinic had no health insurance, and obviously a lot has changed in those 15 years, including the Affordable Care Act. Last year, more than half of our patients had health insurance. They were on Medicaid, they were on a private plan, but they couldn't find a primary care doctor, or they couldn't afford the out-of-pocket costs. This is a story that's familiar to Vermonters across the state, making that tough decision about, do I delay care, or do I actually maybe show up at the emergency room in the middle of the night? And those are the two options for people who are locked out of the healthcare system. You either delay care, and our patients tell us they delay care for years sometimes because they don't have access to a doctor, or they show up at the emergency room, which we know is the most expensive care for our system to deliver.
Yeah, just wanted to for the record to talk about the actual numbers of what it costs. Just from personal experience, I have to purchase health insurance through the Vermont Health Connect exchange because I don't qualify to get it through any of my jobs. And my main source of income is my private practice as a healthcare provider, ironically, that I have to pay the insurance companies for insurance, even though they pay me, and don't raise my pay and haven't really for years. But how much they charge for insurance goes up astronomically. From last year to this year, it went up about $100 a month. So right now I'm paying $674.76 a month for a $6,450 deductible plan. And so I ration my healthcare. Like when I had COVID, I wouldn't go to the doctor until I absolutely had to. And then we were discussing, and even though stuff was supposed to be covered, we weren't sure. So I was thinking can I afford this or that? And I can only imagine what it's like for people with chronic health conditions who every single day are making that decision. It's a violation of human rights, at this point that we're allowing this to continue. So I just wanted to put some numbers on it, what the lowest cost option is. And when you compare that to the Shao report, I believe it was called, and one of the concerns about implementing Green Mountain Care was, the premiums are going to go up too high. But if you look at the price of what they predicted now and then, it's not that different. So why not do the right thing now? If costs are going to go up anyway, we might as well give people more for the cost than they're getting now. It just doesn't make sense. So.
Well, I just want to point out that in Shumlin's own financing plan that he put out when, as a result of Act 48, it saw that under the taxes that he was proposing, which were progressive payroll taxes, that or they were payroll taxes, we would see that 93% of people in the state would see their incomes go up and have health coverage if it was paid for through taxes. It was only the wealthiest 7% of households that would be paying more in their taxes, and everybody would have the same quality of care. And I don't think we can emphasize enough what that would mean. By contrast, my kids are on Dr. Dinosaur, and I know I had to take my kids to the ER the other day, and it never passes my mind that how lucky I am that I don't have to think twice about that. We're just going. I don't have to worry, is it worth it? Is it bad enough or whatever? We just go because they're on Medicaid and we have no copays, no deductible. And so I just think everybody deserves that. And it's not something we should have to think about. And just following up on that, off of the methodology that they, off of that Shumlin plan, we actually, the Workers Center, in partnership with Partners for Dignity and Rights, which is a national policy organization, put together an our own version of an equitable financing plan that was even more progressive and paid through for a different combination of taxes. So I think we have that as a resource for what financing a universal healthcare system could and should look like that would not have any premiums, any co-pays, any out-of-pocket costs for people.
So we have about 5 minutes left because we have to hike back, very long hike back to the State House. But we have committee at 1 and I want to make sure people can get where they need to go. So I'm going to actually open it up to other guests Kate, and then if we have time for one more question, I want to be inclusive if we can, but Kate, go ahead. And
Yeah. While we're talking about it, what is the reasoning behind not trying to pick up where we left off with Act 48, especially, like you said, I feel like everybody is demanding that we do something about health insurance, and we know the federal government is not going to be taking action as quickly as we'd like them to, if ever. And yeah, I'm curious, Brian,
I don't think that's a question I can answer because I'm doing the will of advocates. You would have to ask maybe Ethan or others here.
Frankly, the problem is the leadership of the Democratic Party right now. I hate to say it. A group of us, I think Liz was included, met with the speaker a little more than a year ago. And it was a very polite, cordial meeting, 4 or 5 advocates and the speaker. And the speaker basically went down through some of these things that I enumerated as reasons that it can't happen, which again, I interpret as a lack of political will. And it's a really difficult thing because we don't want to be adversarial with our leadership. We want to give them ownership of this and bring them along and make them feel like they can be part of this, and it's going to be politically viable. It'll help their political standing. But we're not there yet. We're just not there yet.
So I was a lobbyist at the time and worked on that bill. I would say, trust in government right now is at an all-time low. And I feel like government has to show the proof that it can manage a healthcare system, starting with primary care. A manageable piece of our healthcare system, I think, is a good step forward. I would love, a single payer bill. I lobbied on Medicare for all on the national level for many years. But I think starting with primary care, which is a small part of our healthcare system, but a small part that has great rewards in terms of public health and financial savings, makes a lot of sense.
So we are unfortunately right at time. Is it really, can it be brief? And if so, I welcome it.
I just wanted to make a.
You want to introduce yourself? You want to introduce
Alice Bisbee from several organizations. But I just wanted to know how this relates to what's happening at the national level, because I've been to meetings on Medicare Advantage and all this, and I thought maybe somebody could give a good answer as why Vermont has to do this rather than at the national level.
Great, thank you. That's a great question to end on. Any of our guests want to speak?
It would be wonderful if it happened at the national level, but it ain't going to happen anytime soon.
I'd like to comment on that, which is that something I've learned as a legislator is that change happens nationally sometimes from the ground up, or often, I should say, actually. Almost always. So what I've learned is, for example, I introduced a bill around AI and everyone laughed at it. But then the legislature unanimously passed it. We became the first state in U.S. history to pass an AI law. The next year, 14 states introduced them and multiple states passed it. And now you're seeing around the country AI task forces everywhere. When Vermont did it, the world noticed it, and then people had the courage to do it. So let Vermont be the place that takes that step forward with universal health care. And then with Bernie at the chair of the HELP committee, he can say, look at what my state's doing. There's no excuse why this country can't do it. That's what my answer would be. We have to fight on every level. And this is the arena that I'm in and that we're in. And so let's do it. I want to see these halls filled with people in white coats again. I want to see these halls filled with people crying and telling the truth to the legislators so they can't hide it. It can't be hidden anymore. Enough is enough, you know, so let's do it.
I think that's a good note to end on it. Let's do it. Thank you all for being here. Thank you to our guests for each taking time to be here with our caucus. Thank you all for coming, our visitors, and same time, same place next week. We'll be talking about paid family leave next week, right? My people who keep me on the straight. Okay, great.